So we're at 120 plus episodes, and I think this was our first one on doulas. It was really exciting to speak to Melissa Bowley from Flourish Care, who is building basically a doula network. I had no idea that 46 states in the country provide some sort of support or reimbursement, acknowledgement of doula care. That's unbelievable, the progress we've made.
Well, and so many people really don't know what a doula does or haven't even heard the term doula, but they really serve such an important purpose, providing support in addition to someone's significant other, in addition to the doctor, in addition to the fabulous nurses in the labor room, but pure support throughout pregnancy and delivery and after.
And I thought that was particularly amazing that, you know, we always talk about this. Is the clinician in or out of the equation? And it was so clear that the clinician is really, really part of the equation in this discussion. So let's take a listen.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have our guest today, Melissa Bowley, who's the CEO and founder of Flourish Care, which we're going to let her tell you all about. But she is changing the way we think about doula care and the way we access doula care. So welcome.
Thank you so much, Rachel and Dr. Dweck. So nice to meet you. So
You
excited
as
to be
well.
here today. And I'm the founder of Flourish Care. Started Flourish Care back in 2020, and it's interesting because my background is in a very different space. Spent most of my life in medical device development. So I'm a biomedical engineer by background and worked in women's health on the pelvic floor, hernia repair, breast reconstruction after cancer area for most of my career. And it wasn't until I was actually on the other side as the patient when I was pregnant with my first son that I suddenly saw the gaps in maternal health care, actually
Oh,
all
yeah.
women's health, to be honest, which I'm sure we could talk a lot
And
about.
you know, and we've heard you say that, I've heard you say this before, and so many of your founder friends, you know, sometimes it just is that personal bolt of lightning that says, I have to be the one to find a solution for this.
Exactly, 100%. And it was through engineering and a friend of mine who said, you should get a doula. And I asked her, do what? I had no idea what she was talking about. Went to my best friend, PubMed, asked what is a doula in PubMed, and all of a sudden there's 500 peer-reviewed articles. I'm like, this has more evidence than the medical devices that I was working on. So at the end of the day, had an amazing doula for the birth of both my boys, who are now 9 and 11, and just wanted everybody to have access to this. So that's
I
really what
want you
I'm
to definitively describe what a doula does because their job description is truly unmatched. And I will start off with a kind of a funny story. I hope I'm not going to embarrass anybody. I wanted to attend my own son's delivery. Obviously, his wife was having a baby, and the delivery room at said hospital had a limit of how many people they would allow in the room. So I was very much a third wheel and fearful that as an obstetrician I can't go in and be supportive. But they did allow me in if I was quote unquote a doula. So even though I am not a trained doula, I figured as an obstetrician I could sort of fit the bill. And
so.
there I made it to the delivery and I was so happy. So please tell us about the amazing work that doulas do.
And I'm
And
speaking
the
to
new series you're going to do, Undercover Doula.
I love it. I mean, I'm speaking to an experienced doula. I did not know that. So,
Yeah.
yeah, it's a question we get a lot of, and what we talk about is that doula care is really extending that care outside the walls of the clinic. So much of your health care, it happens outside the walls. 20% is what happens, in the clinic, in the hospital, with your physicians, and 80% is happening outside the walls of the clinic. And that doula is that trusted support that's really based in the community, has a similar lived experience to you. They're trained, so there's a multitude of trainings that they can go
Sure.
to. And we vet our doulas. We get to do background checks. We do interviews with all the doulas within the Flourish Care network. But really, at the end of the day, it's somebody like we talk about it as almost like a community health worker that's dedicated to that maternal health journey and really supporting you with. I'm sure you remember how many questions you had that were totally non-clinical. That was mostly what I was asking about. Like, should I be nervous about this? Is this normal? And am I supposed to be feeling like not attached to my child during postpartum? And why is my brain fuzzy? Why does my body hurt so much? Like, these are all things that
Yeah.
a doula can support you with. And at the end of the day, that's what we're doing is we're matching families to doulas in their local community that have similar lived experience, that speak their language and can
Mhm.
support them, and they're culturally aligned to the support that they need.
It's so important because, while we always hope everybody has some sort of support person, whether it's a partner, a spouse, a parent, there are some people who really have nobody. So I think a doula
Yeah.
plays such an important role. And of course, the doctors are usually attending to multiple patients. The nurses are completely overworked, but they're the ones who are usually the one-on-ones. So it really is an invaluable experience.
Yeah, and it's funny
So
because we
when
get
we
a lot
hear
of people that think that doulas are for home births, right? And that's not at all the way that we work
I was literally
alongside.
just about to say that. I think the average person thinks
Go
of a
ahead.
doula for home births.
Yeah.
But you mentioned something that's so critical. In women's health, we talk all the time about how it's not just a single thing or it's a single body system or a single symptom. Talk a little bit more about the expansive nature of the kinds of activities and care a doula might provide. You talked about postpartum. Maybe people don't think of a doula
Right,
in that context. And maybe there's anxiety through the whole pregnancy, or maybe there are some comorbidities or concern, financial concerns, all the things that go
right.
into your life when you're having a baby. So talk about the range of things that doulas are trained to support um, pregnant women
Right. Yeah, and
for.
it goes way beyond again that home birth mentality. And it's funny because when somebody told me about doulas, I was like, "Isn't that for hippies or is it just the good like Nola
The
Montana
swimming pool in the middle
volunteer?"
of the living room.
Right, right, right. But my doula actually was involved in clinical studies and changed the course of care for cord clamping. That whole study that came out of
Yeah.
Rhode Island, she was a part of that study. So like it's just really it goes well beyond what people kind of envision a doula is. And it's almost like a best friend. And we like to engage as early as possible. We say from 12 weeks pregnant through 12 months postpartum. And we want to build that
Wow.
relationship because it's really about that trusted relationship is where we can have the biggest impact. So it starts with like, okay, what are the things that you want out of your birth? Let's talk about what you want. What kind of support do you have? Do you have a spouse involved? Do you have family nearby? Like just really understanding what's going on. Oftentimes we do a blend, hybrid, which is telehealth and in person. So we're often in the homes, like seeing is there food insecurity? If they're, if they have gestational
Yeah.
diabetes, what's actually in the fridge? Like it goes well beyond just that support. It's really understanding what's happening holistically with this family. It goes beyond just the parent, and we actually get the mother. It also goes to the significant other in many cases, and we usually get them involved very early on as well. So what are the expectations on both sides? Are you going to be breastfeeding? Are you going to be pumping? Are you going to be bottle feeding? What are the things that, and oftentimes these are things they may have not been thinking about. So through our educational program, they actually come in, understanding, oh, these are things we used to actually give out. We don't do this as much anymore, but there were like kits that they would get. And it was so funny because we would send it out at about 12 weeks pregnant. And they'd be like, why did you send me diapers? I see that I need baby diapers, but why am I getting diapers too? And it's like, wait, after, for 6 weeks, you could be bleeding. And these are things that like we're not talking about regularly. So it's really that, building that trusted relationship, understanding what the needs are, what of that entire family, and then understanding specifically maternal health wise, are there any comorbidities? Is there hypertension? Are there things that we need to specifically look at? And then being that bridge. That's the thing that I don't think people recognize is we are that bridge to the clinical team. So we've had a couple instances where,
Yeah.
due to other reasons or religious reasons, they wanted to have a home birth, but they were a very high risk pregnancy. At that point in time, the doula's role is look, you have, intrauterine growth restriction, and this is very dangerous. And this is something that you need to make sure that you're getting the right care team. So we can often be that bridge between the family, the patient, the client, and the care.
So, with that said, what is the training? Because I remember when I was again wanting to be a doula, I looked up what certifications are needed, and there really was nothing definitive. What type of training do your doulas get? And I assume there's different levels of training based on what you're
Yeah.
mentioning.
Absolutely. And there's lots of specific training. So, depending on what culture you're trying to support, there's specific training out there. So, there's actually a number of really great trainings. We audit all of them, and we have kind of like our list of 50 or so that are the best that we've seen out there.
Mm,
And those are the
hmm.
ones that we prefer. But we really do go based on the state requirements. So, some states are open
Yeah.
to lots of trainings, other states are, they have a list of four. So it really depends state to state. And we are predominantly Medicaid today. We do about 80%. We've supported about 4,000 families. And 80% are Medicaid, 20% are commercial, but we actually just signed with United Healthcare for their commercial members as well nationally, which is really exciting. So we'll be seeing that adoption beyond just Medicaid, but we've had such an impact in the Medicaid population, which traditionally wouldn't have had access to doula care. But yeah, the training
So,
is definitely something that you want to make sure you go to a good program. And then we do continued education. We do substance use disorder, perinatal mood disorders. We
Mhm.
have an MFM on our team that's currently sharing best practices to coordinate hypertension, gestational diabetes.
That was a question I had. Yeah,
Yeah.
is there medical guidance? Uh-huh.
Yep, absolutely. So we have MFMs and midwives on our team today that do a lot of that mentorship training for the doulas, and then also escalation when needed.
So here's today's hot flash. Postpartum doulas are linked to a 57% reduction in the odds of postpartum depression and anxiety.
help us understand the numbers a little bit. So let's say there are between 3.5 and 4 million live births in the US every year. What percentage use doulas? How many doulas are there? We already know that we have this terrifying growing shortage in availability of obstetricians and overall maternal
Right.
health care throughout this country. So, can you give us a sense of the math, how the ratio might work?
Yeah, the last data point, which was prior to, coverage, which has really changed. 46 states are now doing something around mandates for doula care, whether they're already active or going to be active. So it's really been this huge push. But prior to that, it was about 6% of families who were utilizing. I was one of those 6% utilizing doula care. And I was like, that's not enough. It should really be 60, 70, 80%, which is the goal of Flourish. But right now, the estimates are around 10%. We've nudged it up from 6% to about 10% now that people have coverage, because that was one of the biggest barriers is how are you going to pay
Yeah.
for this? When I looked at it, it was thousands of dollars. I paid for it out of pocket, and then I fought Blue Cross Horizon for reimbursement, and they looked at me the same way, saying, "Do what? I don't know what a doula is." So I was like, "This has to change." And here we are, many years later, 6 years later, and it is changing, but there's got to be so many aspects that drive access. It's not just coverage. People need to be aware of the benefit. Clinicians need to be working with doulas. So, like, how are we working as one team? How are those referrals working? How is it seamless? How is it integrated into clinical
Yeah.
workflows? That's the only way you're going to get broad adoption. And those are the things that we're trying to address state to state through
I
Flourish.
would imagine it's not, it's certainly being a doula is not for the faint of heart based on the hours that babies like to come. This is not a 9 to 5 job.
Right.
How do you find recruitment for doulas based on that difficult schedule?
Yeah, it's definitely people usually get into it because of a personal experience, right? Or
Yeah,
they have a nursing background. And we've got doulas from all walks of life, which is really
yeah.
amazing. But at the end of the day, we really support each other. So we have 600 doulas across 18 states currently, and they are
Wow.
all chatting with each other in our forum all the time. We have dedicated backup support, so they're pairing up with one another for backup in case they end up,
Yeah.
at a different delivery, or it's while they're on vacation. You know how unpredictable birth can
I
be.
sure do. Uh-huh.
We make sure to set that up in advance as much as we can, or they're able to tap into that great community to get that support. So That's ultimately how it's been working. There's about 11,000 doulas. Again, this was prior to reimbursement, but there were data points out there showing that there were about 11,000 doulas out there. So in our models, in our mind, there are enough doulas out there that have capacity in order to support the needs of the community. And then we will obviously grow the supply as needed. But we're assuming that we would need about 2 to 3,000 doulas within our network in order to serve the number of births across the country that we are expecting to.
So what was the driver going from, 0 to 46 states offering some sort of coverage or support? When did that increase start to happen? And do you have a perspective on what was the catalyst for that? We see that now happening with menopause legislation, not nearly in 46 states, but obviously as the conversation and the
Getting
number
there.
of companies and the amount of investment going in, we start to see things move at the legislative level. But 46 states means we've made a huge amount of progress. When did that start and what was driving that?
I think it's a great question because prior to 2020, there were like 2 or 3 states that had mandated doula reimbursement. And it was at very low levels, which it wasn't a livable wage for doulas. So there was a big shift, but there was work being done in like California and Minnesota, and there was a lot of grassroots efforts. But I think it was when the maternal health crisis was named as a crisis and you had the administration get involved and ultimately say like this is something we need to tackle. It's the most important thing in society is like how are we supporting those that are giving birth to the next generation. And so it was really when we defined, hey, we have the worst maternal health outcomes of any industrialized nation, and that realization that really moved policy forward. And I think it was the evidence that was built in these grassroots efforts in those other states over several years that was like, oh, this is one of, and again, silver bullet's the wrong word, but there's no one right answer. It's all of us working together, midwifery care as well. Like we really need to incorporate a lot of different aspects and that team approach in order to get these outcomes. And so at the end of the day, it's not just one thing, but this is one of the interventions that has so much evidence behind it. And I saw it firsthand with my own experience, which I had the best of both worlds. I had my OBGYN if something went wrong and my doula there to make sure I felt as at home in the hospital as
Yeah.
possible and calm and confident. And it changed, all my outcomes and ultimately how I approached postpartum, which was a whole nother, thing I was
Bag
not
of tricks.
doing.
Yeah. Two questions for you. Is there any measurable outcome for those who deliver with the assistance of a doula and those who don't that you can, point to as a measure of success?
Yeah, we actually are doing the retrospective analysis on our 4,000 families that we've supported to date now. We are seeing that there's a Healthy People initiative, which the NTSV rate, which, as you know, is C-section within a normal
Yeah.
birth, is as normal as you would call normal. And we're seeing lower than that amount, which is 23.6% is the Healthy People 2030 goal. And then our preterm birth rates are somewhere between around like 8%, which is below the 10, I think it's 10.4% is the Healthy People 2030 goal. So we're definitely seeing a significant change in our own data, but of the 500 peer-reviewed articles, you see anywhere from like a 50% reduction in preterm birth rates, a 35% reduction in C-section rates. There's just been a lot of evidence showing that you can have these really incredible outcomes with the
Yeah.
addition of a doula. It's not the doula alone that
Of
does it.
course. Well, and look, I mean, this is a self-selected population for sure, so I'm sure
Right.
that has something to do with it. Um, well, so interesting. I think anything that can better maternal health and the delivery process in general. Have we or you and your company taken any learnings from other countries, or do you think we're really spearheading this here in the US?
Oh no, definitely other countries. That was the first place I went when I did my research after having, or even
Yeah.
trying to figure out what a doula was. There's so many different terms in other countries, but countries basically provide all the resources possible to families and you see them thrive. And so that was like even the pelvic floor physical therapy stuff, the
Yeah.
doula care, the child care that's available, the paternity leaves and maternity leaves that are available. Like this is all the infrastructure that
Yeah.
it's not rocket science. It's worked in other countries, and we're just trying to bring it here to the US. So I 100% think a lot of the European countries and those are the places where a lot of this has been proven, and we're just adopting those care
Yeah.
models. So
Fantastic. Well, we will be watching and with great interest. It's been a pleasure. I still am not sure how you go from device management to doula care, but I love this transition. So thank you
I
so
don't know
much
how
for
I ended up
joining
here
us.
either, but I love it. And now I understand why people love OB and MFM. Like it's just the impact you have every day. So thank you so much for what you've done. And now I can call you a doula as well.
Sort of. Great to
Well, thank
speak.
you so much, Melissa. It's always great to hear you. It's always great to see you and to hear about the progress. And, your energy is undaunting and relentless, and you continue to make great progress. So thanks so much for what you're doing to help people create families.
Thank you so much for having me, Rachel. Always good to see you.
Well,
Terrific.
I'm
Thanks,
hoping I
Melissa. Have a
need
great
real
day.
doula training at some point, but yeah.
Oh, I've done it. I actually went through postpartum doula training. I'm like, why didn't I do this earlier? Like it
Yeah.
was, years after I had my kids. I'm like, this would have been super helpful.
Thank you so much, Melissa. Great to
Thank
meet you.
you. Take care.
Bye-bye.
Bye.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.